Hi, everyone. This is Mary Kurek with Frontrunners Innovate, and you know how we love to bring you extraordinary people doing incredible things around the world. And we have an absolutely wonderful example today with Joe Hamel. And Joe is the Strategic Innovation and Emerging Technology Manager for the Department of Health and Human Services in the United States, HHS, Office of the Assistant Secretary for Preparedness and Response. We call that ASPR. He received his BA in molecular biology from Colgate University and his MS in biotechnology for Johns Hopkins University prior to joining the ASPR. Hamel worked as a biologist for the U.S. Army. Yay, thank you for your service. Where he also served as a team leader and chief of planning and policy. Later, Hamel was a program director for the Department of Homeland Security and then a program manager at Johns Hopkins University's Applied Physics Laboratory. And I have to just give a big shout out to someone I interviewed not long ago, General John Bartram, who is the CEO of Bright Star Innovations Group. And if you guys go back and look at that interview, he mentions Joe by name, I think. So he says, you really need to talk to Joe. You need to be interviewing Joe. So here we are. So Joe, wow, I've done a little look-see-up-see on you, a little Google search, and you really are all over the place. Out there and some of the cool things that you're doing. And this is something that the general alluded to. He gave examples of a lot of the new technologies that were coming along to kind of fight off some of the things that are going on now, and pinpointed you as being one of the heads for bringing that forward. So I have to ask you, we always like to start with a little bit of story, a little bit of background. So at what point in your life did innovation in a healthcare setting come into play for you?
Yeah, it started, there's a few kind of defining moments for that. It started pretty early. When I was in high school, I was in this kind of dual enrollment program where, I would spend my morning taking, classes in school, and then I would spend the afternoons in the hospital in kind of like a residency program, if you will, scrubbing in for surgeries, looking at, conducting rounds with attending physicians and just learning the, kind of state of the art, when I was a teenager in high school. And then, really that gave me my first kind of, real taste of, what does the practice of medicine look like, and really kind of a great immersive experience. And, it just kind of, it was something that I knew I'd be involved in some sort of, kind of healthcare, program in some capacity, throughout my life after that. So, went to school, did the molecular biology thing. After I got my bachelor's in molecular biology, I was working as a cancer research training award fellow for the National Institute of Health. I was looking at identifying new cell and molecular mechanisms to identify and treat ovarian cancer. And then kind of 9/11 hit, and I got this kind of weird, it was kind of towards the end of my fellowship. I was looking for a new job. I got this weird all zeros call. And it was from the Army to be a civilian scientist. To take the same principles that I was applying towards, looking for bad cells in the body and apply those towards looking for bad cells in the environment post 9/11. Yeah. So that really kind of led me down a rabbit hole, if you will, and worked in various capacities with the Department of Defense to kind of build out those kind of novel programs. All based on those original tenets and scientific principles. And then, again, really just the application of those principles in non-traditional fashions is really kind of what I really love and appreciate. And it's what kind of led me to, my role in ASPR and kind of what I'm doing today. And what I was doing with the previous, ASPR, and also now I've got this new role as the director of the ASPR program office for innovation and industrial base expansion. So it allows us, an opportunity to really take, new methods and practices and apply them to real challenges. So that's kind of what got me here today.
That's a good story. I like it. So in the work that you're doing now, can you give us what does a day look like? What types of technologies are you working with? Is it more of a research-based approach to things? Tell me how much is sort of academia and how much is sort of the hands-on innovation and technology.
Yeah, sure.
Yeah.
So it's all kind of tailored towards practical application and commercial realization. And it spans the spectrum, right? Of early to advanced technology development, as well as basically realizing different technologies in kind of a commercial capacity. So our team, we call ourselves IBX, for Innovation Industrial Base Expansion. IBX, we were established to really bolster supply chains for life-saving medical countermeasures.
Mm-hmm.
We're looking and recently, and I'll get into it a little bit later, but we've published our 100-day report on how to enhance the United States pharmaceutical supply chain. We're involved in making sure that everybody has enough personal protective equipment, herbal medical equipment's available, and then things that you don't think of, like how to deliver 660 million shots, or if you're thinking globally, 15 billion shots. That takes a lot of ancillary supplies and devices. You have to rethink kind of the distribution and administration paradigms. So that's a lot of what we do today. And really, through what we're doing on through that lens, we're coordinating, these strategic industrial base expansion and innovation investments within ASPR with our federal partners, working with academia and industry, again, to bring these new solutions and expanding the tried and true solutions and practices for response and recovery to this pandemic.
That's fantastic. As we know, in the United States, so many of our areas are now coming back online, basically, if I can say it that way, back to normal. Where I live here on the coast of North Carolina, we're pretty much there, but not so the case in a lot of areas, still in the United States. But what I'm hearing from India, and I was on some calls this morning with people in Africa who are scared to death of a third wave, and all these variants that are out there. Do we in the United States do anything to be of support or service in terms of how we can share any kind of technological breakthroughs or supply chain solutions, if you will? Because that is a huge concern, has been the whole time.
Yeah, that's so we've got a few objectives that we're kind of operating under those pretenses for. To really, we're focused on expanding, securing, and building resiliency across the public health and medical supply chains, and that involves both domestic and with our allies and partners, some relationship building, and also we're looking at creating these not just innovative but also enduring public health and medical supply chain capacities to proactively address these response, this particular response, and to prepare and look at what is the next emergency, whether or not it's on our shore or it's with some of our allies and partners overseas. So it is part of what we think about. It's part of our outreach. It is part of what we do, and we're looking to build resiliency in the system, knowing that we're dependent on a global supply chain.
Oh yeah, that is for sure. So as you look at the different technologies that we maybe apply to public health, what are you seeing is making the most difference? What are you able to take and pull in and utilize in a way that maybe nobody would have ever thought of before, or that you think is making the most difference? I mean, it could be something that we've always, 3D printing or blockchain, or you know what I'm saying? Could be anything that's already out there, but
I'll give you a couple examples. So when COVID hit, basically the number started at 30%, but it went up to 46% of patients with COVID in the ICU succumb to an acute kidney injury. So as a result of that, therapy and other life-saving interventions, that became scarce. And so early in our program, we had, as part of the HHS Advancing American Kidney Health Initiative, had developed portable dialysis systems that could turn tap water into dialysate, that were easily operated and interchangeable among patients. And really, as the need for just these critical life-saving countermeasures like dialysate for these kidney injuries became an issue, we were able to deploy every single portable platform that we had procured for disaster response into health systems to treat these patients with acute kidney injuries. So we did it, with a lens towards, responding to a hurricane or a natural.
Yeah.
They needed to treat those acute kidney injuries. I've got a couple other examples too I can go into.
I like that. Yeah. Would love to hear about if you have a couple of other
Great.
examples. I think we're having some technical difficulties right now too.
Yeah, sure.
Yeah, there we go.
A little bit.
There we go.
Too, so,
Yeah.
All right, perfect.
We're back.
The other that we started back in 2018, kind of looking at, was what we called priority medicines on demand.
Mhm.
We wanted to ensure that the U.S. wasn't beholden to basically pharmaceutical supply shortages that were impacted, that were caused by natural disasters at the time. And what the pandemic was, stopped moving and borders started closing. There were a lot of these critical ICU, medications that are used and on acute and intensive care patients that went into short, and kind of novel manufacturing technologies to bolster domestic production of pharmaceuticals. Active APIs, active pharmaceutical ingredients, precursor chemicals. Most of those are made overseas, and we're working on new ways to basically establish novel continuous manufacturing capabilities to make these sterile injectable drugs that are in shortage, supportive care fluids that are in shortage, and other drugs that went into shortage. By looking at production, polish and fill finish in new ways, taking the footprint of a large batch manufacturing facility and shrinking it down to something the size of a bank vault or refrigerator in order to realize that capacity to make those medicines on demand. That won't, it'll help with our supply chain issues, but it's also going to change the manufacturing paradigm for the U.S. to have a competitive edge in order to produce at lower cost because of this lower footprint. And it also allows us to be done in a very distributed fashion so that, if there's a natural disaster in one part of the country, it won't affect the ability to produce and deliver, pharmaceuticals that might be impacted in one particular geographic region. So that's another kind of effort that we're undertaking. We have two contracts today for making small molecules at scale for the IV sedation medications that are in shortage and analgesics that are in shortage. And we also are we have another effort that's focused on producing supportive care fluids such as saline on demand, which we've demonstrated at HHS headquarters. We took a device, plugged it in a bib and a generator, and made 0.9 normal saline on demand on the sidewalk. So it was, there's a lot in the works.
Fantastic. I love that. This is fantastic. I want to, before we, and I know our time is getting short, so I wanted to go ahead and ask you what new directions and new publications and things like that that you've got coming along, because I know that before we went on, you were telling me about a few. So give me an idea of what you and the team are working on that's coming out soon.
Yeah, so from a new technology perspective, again, we're laser focused on ensuring that we have, you know, production and distribution capacities for vaccines, you know, production capacities for personal protective equipment, and also the development of these sorts of platform technologies, like I just mentioned,
Right.
with Priority Medicines on Demand program, to kind of deliver drugs. But the other piece to this, if we look into the vaccines realm, you know, gene encoded vaccines, you know, emerged out of this pandemic. They've served the model because they've been developed very rapidly. They've been proven to be extremely safe and effective. And I got to say, like, you know, this didn't start, you know, this year. This started back in 2013
Yeah.
with what DARPA had invested in gene encoded technologies. And I just really think that's going to be the next generation of therapeutics. If we look at either gene encoded vaccines or gene encoded therapy that our muscle, and you know, it really was you know, born of the pandemic. That will continue to be a part of our, you know, our lives as we deliver care and as we modernize the public health and medical industrial base. So you know, and really it just underscores the fact that, you know, we need to proactively look at the threat landscape, and we also need to, you know, identify what's coming our way on the horizon, from a, you know, population scale, you know, surveillance perspective, to understand, you know, what new diseases, environmental exposures are out there, and how to counter those using those novel, you know, those novel, like the ones I.
Just a quick question, because you made me think of it. The pandemic, is it ever really going to go away, or are variants of it going to still stick around a little bit and cause us some issues in the future, do you feel like?
Well, I got to say, you know, so far the science has been sound, and we're learning a lot about, you know, what these variants are and what they're not, and with everything that we've seen with the Delta variant so far, you know, vaccine escape has not been something that, you know, has really been, you know, at the forefront. It was originally, you know, an initial concern that there was potential escape around therapeutics or vaccines. Our therapeutics will themselves over time. I think we're going to have, you know, boosters and other things that come into play, to ensure that we're countering these threats, but also, you know, the work that HHS is doing for, you know, disease surveillance with the CDC, wastewater monitoring, communities, you know, at a large scale is tremendous. Understand, you know, kind of the landscape, and then we.
I think I've lost you for a minute. See if you can come back. Hey, Joe, we lost you. You got frozen. That's just a little bit of Zoom going on here. Let me take off my video, see if that helps. Joe, do you hear me? Your audio is muted. Get your audio.
Mary, can you hear me?
Yeah, now I can. That's better. Okay.
All right.
That
Sorry
last
about
line that you said, I missed. I know that you're continuing to talk and I didn't hear you.
Oh, I'm sorry. I was just saying, with our partners, with HHS Protect and the CDC, we're looking at, tracking variants in communities, and making sure that we're adapting our medical countermeasures accordingly, to kind of stay ahead of the curve. So, yes, while they're out there,
Hopefully we can prevent.
proactively, yeah, proactively taking approaches to address this.
Well, great. What great work you're doing. This is fantastic. And I'm excited that, you give us hope. Joe, you give us hope. So that's wonderful. Thank you so much for spending a few minutes with me. And we'll drop in links and, all kinds of information about you in the frontrunnersinnovate.com on our platform. And this will also be a YouTube video. So we'll stick some information there as well. Thank you so much. And, we're all about connections. And so I may reach out and say that there may be some people that we might be able to kind of move back and forth, that will be, helpful. I mean, from the standpoint of a global perspective, we look at how pandemic and all these types of disasters kind of reach out to other people and how they react to them. And I think probably you're almost like a think tank as well as doing, an action tank there as well. You pull it out and then, kind of analyze it and figure out what's going to work. And then you go ahead and implement. So I love the way that you're going about that. Well, we'll be watching to see what else is going on. So thanks
Absolutely.
again. Yeah, I appreciate it. You take care. Have a good rest of the week. And
You too,
we'll
Mary.
be
Thanks so much.
checking in again. Thank you.
All right. Yeah.
Bye.